If you've recently had a baby and you're finding it hard to settle in at home, if it's like you're constantly worried about how the baby's doing or if everything's going to be okay, or if you're worried about other parts of your life and it just feels like there's constant worry going on in the background, those are signs of postpartum anxiety. Now, a difficult childbirth experience can definitely contribute to postpartum anxiety, and that's what we're going to talk about in this video today. I'm Allison Lauren. I have over 20 years of experience as a nurse midwife, helping deliver babies and people to recover from difficult and challenging deliveries. Download my free postpartum care checklist full of tips and tricks to create more comfort and ease in the postpartum period. Postpartum anxiety is really common. First and foremost, I want you to know that you're not alone. A lot of people suffer from postpartum anxiety. Postpartum anxiety can also be linked to postpartum depression. We often characterize anxiety as a worry state, worried about the future, versus depression is usually coming from our past ruminations, if that makes sense. So when we realize what the root of anxiety is, this sense of unease, a difficult childbirth experience and trauma experienced during childbirth can contribute to the sense of hypervigilance, of not feeling safe in the world. Trauma often makes us feel like anything could fall apart at any moment. Now, how that manifests as anxiety postpartum often can look like a constant worry if even the baby's breathing, if you might end up missing something that you should have been paying attention to. Sometimes you walk away from the baby and you have a really hard time even taking your eyes off the baby. This obsessive kind of thinking about whether the baby's doing okay. If it's even related to feeding, diapering, letting anybody else hold or care for the baby can be a great sense of anxiety. So these are all signs that it's like extra, that there's something above and beyond just the normal caretaking that would be involved with taking care of a baby. Don't get me wrong, I understand taking care of a baby is really stressful and there's a lot of things to worry about. But this postpartum anxiety is when there's just this nagging sense that you can't rest, you can't let it go. You're never going to really switch off the worry. And I'll tell you one of the tips and tricks to dealing with anxiety and an anxiety attack is to use your five senses. So we're talking about sight, smell, hearing, touch, and taste. Now, for sight, can you look around and notice one thing in your visual field that you can put your eyes on and lock onto and just narrate? I notice the stickers. I notice the light coming through the window. I notice my baby's breathing. Now we're talking about hearing. What do you hear? Is it even a sound that you make yourself, right? I can hear my fingers rubbing. I can hear the birds outside. I can hear the television in the background. I can hear the traffic outside the front door, whatever that is, right? You with me? Smell, what can I smell? And if it's not something immediately available, can you smell your clothes? Can you just look for a smell around you? Smell anything to do with the baby. Maybe you have essential oils or a room spray that you can spritz and smell. Just be mindful of the sense of smell. So we have sight, hearing, smell, touch. Can I touch something? What does that feel like? What am I noticing about texture? And then taste, right? If you have anything that you can taste, even if you're just going to lick the back of your hand, something that will give you any kind of taste. And what we're doing is using the senses to ground. We're using the senses to bring us into the present moment. So anxiety is about worry, about the future, about what might happen. And so to pedal back and to pull back out of anxiety, we're using the five senses to ground us in the present moment. I'll never forget a patient that came in with postpartum anxiety, and just applauding her for being able to speak to postpartum anxiety and what she was experiencing, knowing what anxiety is like and how hard it can be. We were able to troubleshoot and come up with plans and strategies to help her work through that anxiety. When there are these holistic measures of mindfulness and grounding, that's where I like to start with patients. And then, of course, there are times that medications are really helpful. If anxiety is getting in the way of you being able to sleep at night or function throughout the day, it can be that some medication can get you through a tough time. Now, often these medications are benzodiazepines, and I find them really difficult. It's like if I were to take Ativan, suddenly my day is gone. I don't really have much else happening other than having to recover from feeling kind of hungover from the medicine. So I just like to let people know that that can be one of the side effects, is really that drunk and drowsy kind of feeling. And they can also be habit forming. So we don't want to use benzodiazepines without counseling patients about their addictive potential. So these other non-medication approaches to dealing with anxiety are super helpful. And of course, this is about you finding a way to work with your own anxiety so that you can be more present for your baby and your family. We want you to be completely activated, full of agency, and not preoccupied with unnecessary worry. The steps to getting there can also include working with the trauma of a difficult or traumatic childbirth experience. And that's really the heart and soul of my work and what I do with patients in my coaching program. Please visit my website if you're interested in learning more about that and the online groups that I have to offer. My name's Allison Lorne. Thank you so much for watching. I hope some of this was helpful to you. Please leave a comment below if you have any questions or if you'd like to see anything else in future videos. This is Holistic Birth Recovery.